Welcome to your open enrollments for TSG Solutions. Your open enrollment will be from August 14th through August 22nd. My name is Mireya Saucedo and I will be your host. Open enrollment is that time we have to make changes, whether we're adding dependents, dropping dependents, or making a new plan selection. Open enrollment is that time to do so. All of you will have to go on to Benetrack and make all of your elections through Benetrack no later than August 22nd. Any changes you do make will become effective September 1st. All full-time employees working at least 30 hours a week are eligible for benefits. Your eligible dependents would be your spouse, your state registered and unregistered domestic partner. And now, because of healthcare reform, our children can remain on our plans till the age of 26, regardless of student status or marital status. Now, once open enrollment has closed, I really don't have another opportunity to make changes until next open enrollment. However, if I have a qualifying status change during the year, I may be able to make those changes during the year. Some examples of a qualifying status change would be marriage, divorce, birth or adoption, or loss or gain of benefits. So just a really quick example, I do have a 19-year-old daughter who's working full-time, has her own benefits. However, she is going back to college full-time, and as of August 19th, she will be going back to school, quitting her job. As soon as she loses her benefits, I will have 30 days to bring her back onto my plan, even though I'm not in my open enrollment. So any qualifying status change you do have must be reported to Human Resources within that 30-day window. So let's talk about what's new. Your vision plan is going to be moving to the VSP network, and your flexible spending account and your limited flexible spending account will now have a rollover, so it's no longer going to be a use it or lose it plan, which is very good news. You will also have a 2.5-month grace period. So let's take a look at your options. You do have 3 medical options to choose from. You have Cigna as your medical group. You have an HMO option, an Open Access Plus option, and your high deductible health plan. Before we go into the details of your HMO plan, with your HMO plan, you must choose your primary care physician, which will be directing the majority of your healthcare needs. Your primary care physician must refer you to a specialist, with the exception of an OBGYN specialist. Each family member may select their own primary care physician, and you can change your primary care physician at any time by calling your insurance company directly. There are no changes to your HMO plan, so I just want to point out a few things under your plan as a reminder. You do have an out-of-pocket maximum per individual of $2,000. So what does that mean? In a calendar year, if I am to reach that $2,000, anything after that is covered at 100%. So let me give you an example. Your inpatient hospitalizations are 20% of whatever the bill is. So if you were hospitalized and for some reason you did reach that $2,000 as an individual, anything else after that within that calendar year would be covered at 100%. Also, our office visit copays are $30, and our specialist copays are $40. Now, emergency room is a $100 copay, whereas urgent care is a $25 copay. So I always encourage you, if you are needing to see the doctor urgently and you're not able to get in to see your primary care physician, and it's not a life-threatening emergency, you want to save yourself some time and money, take urgent care as the next option. And also, anytime you do go to the urgent care, please make sure that you are going to an urgent care facility attached to the medical group you are assigned to. The other thing I wanted to point out under this plan is that you do have chiropractic benefits. So you have a $10 copayment, and for the chiropractic benefits, you do get 20 visits per year. Also, if any of you are taking medication on a daily basis, I really encourage the mail order program. You get a 90-day supply. For example, if I am taking the mail order program and my medication is a generic medication, I would get a 90-day supply for $20. So you could really see how you will see those savings. Now you have your Open Access Plus option. So you do have the freedom of choice with this option, no referrals required. You obtain a higher level of benefit by receiving your services from participating or in-network providers, specialists, or facilities. Certain medical expenses you may be required to pay out of pocket and meet the deductible before the insurance company will cover the expenses. Once your deductible has been fulfilled, you and the insurance company will each share a percentage of the cost for your care, and this is known as a coinsurance. So again, there are no changes to your open access option. So on this plan, you do have a deductible of $500 per individual. Out-of-pocket maximum is $2,500 for the individual, and this deductible will only apply to certain services. For example, my x-rays and my basic labs, hospitalizations, outpatient surgery. That's when my deductible will apply. If I'm only going to my doctor's office, my specialist, or an urgent care, I'm only paying my copay. So for example, if during that year I've only gone to my doctor's office, or maybe I had to make a trip to the urgent care, I would only be paying my copay and deductible does not apply. However, if I went to the hospital, or maybe I had an outpatient surgery, I would have to pay my $500 deductible first. Then the insurance would kick in, pay 90% of the bill, and I would pay 10% of the bill. And again, let's keep those out-of-pocket maximums in mind. As an individual, if I meet $2,500 within that calendar year, any service after that would be covered at 100% for the remaining of the calendar year. And again, my preventive services are covered at 100%. Let's keep in mind, if I do go out of the network, then I will have a 30% coinsurance for those preventive services. So we could see how we will get those bigger savings staying in the network. And again, our maintenance medication, really important. Let's keep in mind, again, any of you folks who are taking medication on a daily basis, you will see those savings by going through and ordering our medications through the mail order program. Healthcare reform. I'm sure we've heard plenty about healthcare reform, so I'm going to keep it very simple. Effective January 1st, we are all required to obtain medical coverage to avoid penalties at the end of the year, which will be 1% of our annual income, or $95, whichever is greater. As we can see in 2016, those penalties will increase, and I will have a 2.5% penalty of my annual income, or $695, whichever is greater. So we could see those penalties will definitely be going up year after year. And if any of you have any questions in regards to healthcare reform, and you still really are having some doubts as to what are the best options for you and your family, maybe you have a child over the age of 26, or just have friends and family that aren't being offered medical coverage through their employer, any questions in regards to healthcare reform or individual policies, Barney & Barney does have the insurance advocates who do specialize in those departments. If you have any questions, please do not hesitate to give them a call. So now we have our last medical option, which is a high deductible health plan. So what is a high deductible health plan? This is really considered to be a consumer-driven health plan. A consumer-driven health plan combines a high deductible health plan with a health savings account. So consumer-driven health plans are intended to improve the consumer's healthcare choices, offer consumers incentives to exercise greater control over healthcare purchases, and help consumers become educated when it's time to spend money on healthcare services. So, what is the difference between a high deductible health plan versus a traditional PPO plan? They're very similar. However, with a traditional PPO plan, I do not have the option to open up a health savings account. Some of the key features of a health savings account is I can set aside my contributions on a federal pre-tax basis. My balances do roll over from year to year, and this is my account. I own it, I manage it. I can really take control of the amount that I would like to contribute. So on a health savings account, those funds that I do put into my health savings account, I can use for my deductibles, for my medical, dental, and vision out-of-pocket expenses. The health savings account contribution limits for the employee only for 2014 is $3,300. Now for 2015, we are going to have a little increase, and that will be $3,350. For employees plus dependents for 2014, that's going to be $6,550. And again, for 2015, that's going to increase to $6,650. Let's go over some of these health savings account eligibility rules. For you, the employee, to be eligible to open a health savings account, you must be enrolled in a qualified high deductible health plan, not be enrolled in a non-high deductible health plan, including a spouse's plan. Also, if you're on Medicare, TRICARE, or a prescription drug-only plan, you may not open up a health savings account. Also, not be claimed as a dependent on another individual's tax return other than your spouse's. Not have received any health benefits from the VA or one of their facilities, including prescription drugs, within the last 3 months. And also, if you are on a to open up a health savings account, you cannot open a general purpose flexible spending account. You may only open up a limited purpose flexible spending account, which would only be for your dental and vision expenses. Some examples of what we can use our health savings account funds would be for our unreimbursed medical, dental, and vision expenses, orthodontia, prescriptions, maybe our premiums for COBRA or health coverage while receiving unemployment compensation, Medicare's Part B and D, some long-term care premiums, and medical supplies. TSG Solutions has elected Health Equity as their preferred bank to handle all of your funds of your health savings account. So all of the funds set into this account will be directed by Health Equity. So how does my high deductible health plan with health savings account work? As an individual under this plan, I have a $2,000 deductible. If I have one additional dependent under my plan, I will be considered a family and will have to meet that family deductible. All of my services are going to be subject to my deductible. So anytime I go to the doctor's office, maybe I'm having some x-rays or some lab work, I'm being hospitalized, going to the emergency room, now all of my services are applying towards my deductible. So every time I go in to have a service, I am paying that service fee. Once I do meet my deductible, I will be paying a 20% coinsurance, and my insurance will be paying 80% of that bill. So again, all of my services are subject to that deductible. And again, very important under our high deductible health plan, which is different than our open access plan, is if I do have even one additional dependent under my plan, I am considered to be family, and I must meet that family deductible, whether or not just one of us is using those services. I still have to meet that family deductible. Now let's review your tools, resources, and discount programs. You can register online with Cigna to obtain all of your personal benefit information, view claim status. Maybe you lost your ID card and need to order an ID card. You can do all of this once you've registered online with Cigna. Once I registered online with Cigna, I can take a look at the different discount programs available to you. So, for example, you're working long hours and can definitely take advantage of massage therapy. You can go through Cigna and obtain a discount. Maybe you would like to go get acupuncture or maybe join a gym. These are all services that you can go through the Cigna website and obtain discounts at. So definitely navigate the system and take a look at the different discounts available to you. You may find one that does appeal to you. So once you've registered online with Cigna, you can download their mobile app. So basically, all of the information you can obtain once you've registered, you'll be able to obtain through your phone. I know we're always on the go, and being able to access our information at the time we need to is very handy. So definitely download the mobile app once you've registered. Now let's go over your dental options. You have a PPO dental option through Lincoln, and again, with my PPO option, I have the flexibility of choice. I do not have to choose a primary care dentist. I can go in network, I could go out of network. However, always keeping in mind, if I am going to dentists that are contracted under the Lincoln Dental Network, I am staying in the network and I am getting those discounts. Under my dental PPO plan, I have a $25 deductible as an individual under this plan. That deductible applies to my basic and major services. My preventive services are covered at 100%. That would be our 2 basic cleanings a year. Those are considered to be preventive. Also, our oral examinations and x-rays attached to those 2 basic cleanings a year are also covered at 100%. So again, my deductible does not apply to my preventive services nor any out-of-pocket expenses. I do have a $1,500 annual maximum benefit, and this maximum benefit is $1,500, and this is for every individual under my plan. We each get our $1,500 maximum benefit every calendar year. Our basic services in network are covered at 90%, and our major services are covered at 60%. You do have orthodontia coverage for children and adults. That is a 50% coverage up to $1,000 coverage for the lifetime. So once you've used up those $1,000 for your orthodontia services, that's it for the lifetime. There's no refilling that $1,000 the next calendar year like there is with your annual maximum benefit. As I mentioned earlier, you now are going to have VSP as your vision provider. Again, this is a vision PPO style plan. The only difference with our vision PPO plans is that if we do go out of the network, we must pay for our services up front, submit our claim forms, and then wait for a reimbursement depending on the service we received. If we are staying in the network for our vision exam, we have a $10 copay. We have a $25 copay for our lenses, and we have a $130 frame allowance or $130 for allowance for our contact lenses. It's one or the other. If I do decide to get contact lenses, I want to make sure that I fill that complete allowance on my single visit so I don't lose out on any of that benefit. So let's review our flexible spending account. Earlier, I mentioned there would be a rollover, but first I just want to remind you what a flexible spending account is. First off, our flexible spending account plan year runs from September 1st through August 31st. I have two components under my flexible spending account. One would be my health care, which would be for all of my medical, dental, and vision out-of-pocket expenses. Unless I'm under the high deductible health plan, then I'm only allowed the limited purpose flexible spending account, and that would only be for my dental and vision out-of-pocket expenses. For the health care, my maximum contribution is $1,000, and for my dependent care, that maximum contribution is $5,000. Some of these eligible expenses, again, for my health care, medical, dental, and vision. My dependent care, this would be for my daycare centers, maybe my before or after school programs for children up to the age of 13, summer day camps, and even if I'm taking care of my elderly parents and they do require adult daycare, I can use my dependent care flexible spending account for those expenses. Once I have made my elections for my flexible spending account, I really cannot change those elections unless I have a qualifying status change again. So if I get married, divorce, maybe I have a child or adopt a child, or loss or gain of benefits, those would be the only times that I can change those elections during the year. Otherwise, I do have to wait till the next plan year to change those elections. As I mentioned, we now will have a carryover, so this no longer is going to be a use it or lose it plan. The plan year runs from September 1st, 2014 through August 31st, 2015. You will have the opportunity to carry over up to $500 of any unused FSA funds from September 1st, 2014 through August 31st, 2015. To the September 1st, 2015 through August 31st, 2016, and get reimbursed for expenses incurred during that time. If you have not had the opportunity to incur expenses during the plan year, the carryover allows you additional time to incur expenses up to the allowed carryover amount. So the plan will provide a run-out period from September 1st, 2015 through November 30th, 2015, allowing you to seek reimbursement for expenses 3 months after plan year ends on August 31st, 2015. Here's just a snapshot example of how those FSA tax savings really work. If we have a person that makes $36,000 a year and puts aside $2,000 into their flexible spending account, at the end of the year they would really be seeing a $614 savings in taxes. So again, our limited purpose flexible spending account for those of you that are on your high deductible health plan would only be for our dental and vision out-of-pocket expenses. There are no changes to your basic life and accidental death and dismemberment policy. For our basic life coverage, it's 1 times our annual salary up to $300,000. For the accidental death is the same, 1 times your annual salary to $300,000. I always encourage all of us to update our beneficiary information. So nothing else is needed from us under the basic life policy, but just please make sure to update your beneficiary information. If you would like to get additional coverage, you can do so. Any additional coverage you do get will be paid by you, the employee. For employees, you can get additional coverage in increments of $10,000 up to the maximum of $500,000. For spouse, this would be in increments of $5,000 up to the maximum of $100,000. And for children, you have the availability to elect $5,000 or $10,000 for children from the ages of 14 days old to 26 years old. If you are not newly eligible, you will have to fill out an evidence of insurability form. Here's a sample of what our rates would be for our additional life coverage. This is going to be based on your age, and per every $1,000 you elect, you can take a look at what those rates would look like to you. You also have short-term disability coverage. This is paid 100% by your employer. You have a benefit of 60% of your monthly earnings for a maximum of $2,500 a week. The elimination period is 7 days under your short-term disability. You also have long-term disability coverage, again paid 100% by your employer, and this is a 60% of your monthly earnings. The maximum benefit is $7,500 per month, and there's an elimination period of 180 days. You also have the Employee Assistance Program, which there are no changes to. So just as a reminder, the Employee Assistance Program is here for you, the employee. If you're ever in need of any advice on any situation, whether I was maybe a victim of identity theft and I don't know where to begin, maybe I'm having some legal or financial issues, if you do obtain a lawyer through the EAP, you also can obtain a discount. Or maybe you have 2 teenage daughters like I do, then definitely take advantage of the Employee Assistance Program. This offers services 24 hours a day, 7 days a week. Or if I feel like I need some more personal face-to-face time, I do have 4 face-to-face sessions per member per issue. So again, this is paid 100% by my employer, extended to my dependents and any family members that live in the home with me. Let's also not forget that this is 100% confidential. So no worries. My employer is not going to know that I took advantage of the Employee Assistance Program. And again, extended to my dependents and any family members that may be living in the home with me. So if I have any of those wonderful brother-in-laws, cousins that maybe have welcomed their stay, we can send them on over to the EAP. Maybe they'll get a little advice on how to get off of our couch and out of our home. So definitely keep the Employee Assistance Program in mind and utilize it if you are just needing a little advice, and take advantage of this service, as it will be at no cost to you. Barney & Barney holds monthly well-being challenges. So this is to help raise awareness and engagement by offering fun activities, exciting incentives, and just an easy, user-friendly method to participate in our monthly challenges. So some of the topics would include fitness, weight maintenance, some stress management, nutrition and cooking, help us to set some goals, and self-care. You can win some of these monthly challenges, we can win some cool prizes like Apple iPads, a $75 gift card, a $100 charitable donation. So definitely participate in those monthly challenges. Well, folks, this concludes our open enrollment. But before we wrap up here, I just want to provide you with some reminders. Again, please review your personal options, review your new payroll deductions, and you'll be able to do this through Benetrack. Again, we must go through Benetrack and confirm our elections. We have until the 22nd of August to make our elections and confirm any elections we have made.